In between juggling career, family, and relationships, many women may forget to take care of themselves. Since May brings us not only Mother's Day, but National Women's Health Week, it's a reminder for women to take the time to manage their health, no matter what their age or stage of life. Here to talk about why it's so important for women to talk with their doctor about their health concerns are OB-GYN Dr. Padmavati Garvey from CareMount Medical Group and clinical assistant professor at the Icahn School of Medicine at Mount Sinai, and her patient, Erika D'Aquino. Thank you so much for joining us, ladies.
Thank you for having us.
Thank you.
Dr. Garvey, let's start with you. Women are so busy juggling career, family, friendships, and relationships. Why is it so important to remind them to make time for themselves?
A woman's health is extremely important. As a 51-year-old wife, mother, and physician, I find myself in the same boat with a lot of my patients, having to deal with hot flashes and mood swings and work-life balance issues. I talk to my patients about the things that work for me. I encourage them to eat a healthy diet, to try to exercise regularly, to stay on top of recommended screening exams. And along those same lines, Erika and I are here to help lift the taboo that a lot of women feel when it comes to talking about postmenopausal vaginal atrophy.
Well, you bring up a great point. Most of us are familiar with the symptoms of menopause, but we really are interested in the symptoms associated with postmenopause. Tell us, how are they different?
So when a woman's ovaries stops making estrogen, this lack of estrogen thins the lining of the vagina. And this can cause a burning sensation, irritation, issues around urination, having to urinate frequently, and it's important for women to talk to their healthcare providers about these symptoms because there are options available to them. One such option is S-string, which Erika and I both use, and discussing this option with healthcare providers, going over the risks and benefits to make sure it's the right option for them is important.
Great advice. So, Erika, what advice do you have for women who may feel uncomfortable about discussing embarrassing symptoms with their doctor?
Well, a couple of things on that. First, talking about the postmenopausal symptoms. For me, I thought I was experiencing a urinary tract infection. So I had called my primary physician and asked for antibiotics, which were completely ineffective because that's not what it was I was experiencing. So when I had contacted Dr. Garvey and she had gone over the postmenopausal symptoms and explained to me that this is what was going on and then prescribed the S-string. So the takeaway here is not to diagnose yourself. And second, to make it a little more comfortable when talking to your physician, maybe make a list before you get there. And that way you're, one, not forgetting what it is those symptoms are, and two, if you're not able to actually read the list because it's that uncomfortable, maybe to share the list with your doctor so that she or he can read off the symptoms for you.
So you gave us a great story in your own experience, but just to kind of encapsulate why it's so important, like what are women sacrificing if they don't open up and share these symptoms with their doctors?
Well, you will live uncomfortably if you're not sharing these symptoms. You know, your doctor has heard it all. They've seen it all, they've experienced it. So I think if you're not willing to share what it is you're going through, you are never going to get the relief.
Very great point. So, Dr. Garvey, any final words of advice, and where can women go to get more information?
Well, a great website is askforthering.com, and it's just important for women to take charge of their health. There's no reason to suffer. And they should feel comfortable talking to their healthcare provider.
Thank you both so much for joining us today.
Thank you.
Thank you.